My name is Mary Corbett and I'm the Director of Midwifery here in Mullingar Maternity Unit. Thank you for taking the time to watch this video, and throughout the video you will meet various members of the team. My role is to support the staff and the patients here in the maternity unit, and throughout the video you will meet various members of the multidisciplinary team who will explain their function and their role within the maternity unit.
See you, for example, in a booking clinic or an antenatal clinic. We would take your history, do your blood pressure, measure your urine, potentially check on baby, and make a plan for the pregnancy.
We see patients during booking clinic from 10 to 13 weeks. Then we see them usually every 4 weeks or 2 weeks from 28 weeks until delivery.
I will bring you along to have your urine testing done and your blood pressure, and go through a few little minor details and introduce you to the area, and then you'll see the midwife, staff nurse and the doctor following on from that.
We make a plan. We do their blood pressure, their urine. If they have any problems, we would refer on to a specialist. Other than that, they will see the obstetrician, and they will be told when to come back, whether it's when their next visit will be to their GP and when their next visit will be to the hospital as well.
I will meet you and we will go through your history, and we document that in your chart. That's your first visit to the hospital, and we will inform you all about what you can expect throughout your pregnancy.
When women come in to book in for the very first visit, they usually will express interest in antenatal classes and a referral is sent to me. Then I'll contact them later on in the pregnancy, closer to the 3rd trimester, and they start their antenatal education then.
We see all women before they go into labour. I meet all the women every day, answer any of their questions and put them at ease while they're labouring or prior to discharge home.
So we'd always encourage women that please call us anytime, day or night. Call the hospital and ask to be put through to the antenatal ward or the labour ward, and we're very happy to advise you over the phone and just advise you whether you need to come in or whether you can stay home for a bit longer.
If women have any concerns, please don't hesitate to phone the unit. The number is available to you on your white card. Ring us, ask us for advice over the phone anytime, day or night.
I would see the women almost every day. I do a ward round with the doctors, and we would review the women in the postnatal period if they have any concerns, if they have any questions. And I would link in with them on a daily basis.
We'll help you feed baby, we'll get you some tea and toast and get you nicely settled in on the postnatal ward.
If I meet you on the postnatal ward, I will be there to help you with any of your personal hygiene needs that you may have. I'll also help you feed your baby, I'll teach you how to bath your baby, and I will support you with any other thing that you may need me for.
So obviously whatever you require, whether it's something that we have on the menu, we'll always accommodate everybody's dietary requirements.
My job is to help with infant feeding, sometimes breastfeeding, while we all know that there's lots of health benefits both for mother and baby. For mother, there's I suppose one of the ones that lots of people know is that it helps you get back in shape, but it also helps with a lot of maternal cancers and lowers your incidence of diabetes. The same for babies, it really helps build up their immunity.
And we would see the ladies after they've had their babies, and we would explain to the ladies how to strengthen up their tummy muscles and to strengthen their pelvic floor muscles. We also would provide the ladies with a leaflet, and on that leaflet there's a telephone number of all the physiotherapy departments in the region.
Hello, you're very welcome to Women's Health. My name is Gemma Gannon and I'm the manager of the unit here. When you reach Women's Health, you will come to a desk in front of the reception area where we have a COVID questionnaire. Prior to completing the questionnaire, you use the hand sanitizer and sanitize your hands. You'll complete the questionnaire then and bring that to the reception area where you'll be welcomed to the unit. The receptionist will take your details and confirm that everything is in order. You will also be given a container to provide a urine sample which we will check on your visit as well. Then you'll be directed to go to the waiting area. It may be waiting area 1 or waiting area 2, and you remain there until you're called by the healthcare assistant. The healthcare assistant will bring you into the hub area and we will do your vital signs. We'll do your blood pressure, we'll do your weight, your height, and calculate your BMI. After that, you'll be directed to go back to the waiting area again, and then you'll be called for your ultrasound. This is your 12-week scan, and the sonographer will introduce herself. She'll do your scan, and after the scan, you'll be directed to wait back in the waiting area again. After that, you'll be called by the midwife to one of the interview rooms. This is where the midwife will introduce herself. She'll go through your chart. We do a comprehensive history to include your medical, surgical, and any other information that we can gather. From that, we're able to plan care for your pregnancy. We will take your bloods as well. The bloods we take include your viral studies. We do a full blood count and we do your blood group. We also will give you information at that point, and we will do a plan of care for your antenatal care. You will then be directed to go back to the waiting area. You'll be called then by the obstetrician and you'll be seen by the obstetrician.
Hello, my name is Dr. Fathiya. I'm the senior obs and gynecologist. You will come and see me after you see your midwife, and we will go through your scan results, and then we will confirm your estimated date of delivery, and then we'll go through your history and discuss any concerns that you might have, and then we will make a plan based on your history for the rest of your pregnancy.
After leaving the doctor then, we ask you to go to the reception area, and in the reception area the girls will give you appointments. One appointment for your glucose challenge test, which every pregnant woman has, and another appointment to come back for your major scan, your anomaly scan between 20 and 22 weeks, and an appointment for your next antenatal visit where you will see your team in the outpatients department. And that would complete your visit then to the booking clinic.
I run the Perinatal Mental Health Services. Pregnancy is a time of great change, physically, emotionally and psychologically. It's important to be mindful of your emotional health and well-being during this time. It is normal to feel a wide range of emotions including excitement, joy, worry, stress and responsibility. You are also pregnant during a very unusual time, a global pandemic, which contributes to new and unexpected challenges. You may need additional support in relation to your mental health if your symptoms persist for more than 2 weeks. Your symptoms interfere with your ability to work or carry out your usual day-to-day activities. Your symptoms cause considerable upset and distress, or you have suffered from mental health difficulties in the past. Mental health difficulties in pregnancy and after the birth of your baby are relatively common. Up to 1 in 5 women will experience a mental health problem in pregnancy or the first year after birth. If you have suffered from a mental health problem in the past, you are more vulnerable to relapse at this time. This is nothing to feel ashamed of. With the right help and support, you will be back on track and begin to grow in confidence as a mum and enjoy being with your baby. Referrals to the Perinatal Mental Health Service can be made by your GP, midwife, obstetrician or public health nurse.
Hi, my name is Amy and I am a diabetes midwife. In our unit in Mullingar, all women are offered a test for gestational diabetes in their pregnancy. If you've had gestational diabetes before, you will be offered an oral glucose tolerance test between the 16th and 20th week of your pregnancy, and then again at 24 to 28 weeks if the first test is negative. If this is your first baby, or you've never had gestational diabetes before, you will be offered a test between the 24th and 28th week of your pregnancy. This involves coming into the hospital and having 3 blood tests. The first is a fasting blood test. Once this is completed, you will take a glucose or sugar drink, and then you will have 2 further blood tests, one an hour and the second 2 hours after finishing your glucose drink. These 3 tests look at the sugar or glucose levels in your blood to see if your blood sugar levels have been affected by the hormones of pregnancy. If any of these tests show high blood glucose levels, I will call you and we will discuss what this diagnosis means for you and what the next steps will be in your care.
Gestational diabetes is one of the most common health problems that can happen during pregnancy. It affects as many as 12% of pregnancies in Ireland and can lead to serious problems for both mum and baby. Certain women are at higher risk of developing gestational diabetes. For example, if you are overweight, if you have a family member with diabetes, if you had gestational diabetes in a previous pregnancy, or depending on your ethnic background. If you are at risk, you will receive a blood test for gestational diabetes between 24 and 28 weeks of pregnancy. If you are diagnosed, there are day-to-day changes you can make to stay healthy. How much exercise you get and what kind of food you eat can have important effects on your health and your baby's health. But what happens when you have gestational diabetes, and how can diet and exercise help? Food and drinks are broken down in your digestive system. The sugar they contain is absorbed into your bloodstream. But sugar needs insulin to work. Insulin is made by the pancreas and helps sugar get into your cells. Insulin acts like a key that lets the sugar move from the bloodstream into the cells of your body where it is used for energy. Pregnancy hormones change the way insulin works in your body. In the later stages of pregnancy, these changes make it difficult for insulin to unlock the cells and allow the sugar to enter. This is what is known as insulin resistance. Some insulin resistance is normal in pregnancy, but this means that your pancreas needs to work extra hard to keep blood sugar levels in a healthy range. When you have gestational diabetes, your pancreas is not able to keep up. As a result, too much sugar is left in the blood. However, a carefully planned diet with high fibre carbohydrates and no added sugar can make it easier for your body to manage the sugar in your blood. Exercise will also help keep blood sugar low, as it improves insulin's ability to unlock the cells and uses up sugar for energy. If blood sugar is controlled, your chances of a healthy pregnancy are the same as a non-diabetic mum. This makes diet and exercise powerful tools for a healthy pregnancy. However, if blood sugar is not well controlled, this can lead to problems in both mum and baby. In a study of 23,000 pregnant women around the world, researchers found a link between high blood sugar in mum and babies that had grown too big. Researchers also found a link between high blood sugar and preeclampsia, premature delivery, need for caesarean section, birth injury, and abnormal sugar control in baby. Diabetes during pregnancy can also put you and your baby at risk for problems later in life, including type 2 diabetes and heart disease. But there are actions you can take. Changes in diet and exercise, combined with close monitoring, can successfully manage blood sugar in 7 out of 10 pregnancies. So no better time to start than now.
name is Sinead Thompson and I'm a community midwife at the National Maternity Hospital. I designed and created Labour Hopscotch in 2015 in response to an increase in the epidural rates and also in medical interventions during labour and birth. The principle of Labour Hopscotch is to encourage optimal fetal positioning. This means having your baby's head in the optimum position, lined up so it can descend into the pelvis in the optimum position for labour. When this happens, it triggers the spontaneous onset of labour. When women go into spontaneous labour, it's less likely that they'll need induction, and that means that there'll hopefully be less intervention in their births. The Labour Hopscotch framework aims to support and promote natural and active labour. It is encouraged for all women, regardless of the care pathway that they choose for their birth, but encourages more natural methods of pain relief where possible, for as long as possible in labour. Using the idea of the game Hopscotch we all played years ago, each of the steps can be undertaken to remain active during labour. The process can start at home, beginning at the bottom of the Hopscotch board when you're more active and mobile. The bottom square of the Labour Hopscotch is called the mobilised square, and it aims at promoting optimal fetal position. There are 4 activities associated with this step, and it's important that these 4 positions are practiced throughout the antenatal period in preparation for your labour. Your midwife will explain the positions to you during your pregnancy. Our research findings, which we published in 2019 in our research study, showed that women who practiced Labour Hopscotch had reduced epidural rates, reduced the caesarean section rates, increased spontaneous onset of labour and vaginal deliveries, and most of all, there was an increase in birth satisfaction rates. Having a positive birthing experience makes a smoother transition to parenthood.
Welcome to the Fetal Assessment Unit. All pregnant women will be offered a fetal anatomy ultrasound in the 2nd trimester. You are allowed 1 person to accompany you. Children are not allowed in the scan room. Tissue paper will be tucked into your clothes to protect them from the ultrasound gel. Gel is put on your tummy, which may be cold. The sonographer will move a handheld device called a probe over your tummy to carefully examine your baby's body. The ultrasound is safe and painless, but the sonographer might need to apply slight pressure or move you to your side during the scan to get a clearer view of your baby. The ultrasound takes approximately 15 to 30 minutes. You might find the sonographer is quiet during the scan. They are concentrating on the detailed ultrasound, so don't be alarmed. The anatomy ultrasound can tell you how your baby is developing and check for physical birth defects. The majority of babies are healthy at birth. However, a small number will have an abnormality. If something unexpected is found, you will be told immediately and appropriate follow-up will be organised. Follow-up could be in the ultrasound unit in Mullingar Hospital or to a specialist fetal medicine unit. On occasion, we might not be able to complete the ultrasound and you might be asked to come back. This may be caused by the baby being in an unsuitable position or if your weight is above average. Don't be alarmed, we just need to have a better look another day. The ultrasound cannot detect all birth defects or diagnose all conditions. Although a normal anatomy ultrasound is reassuring, your baby may be born with a condition that was not seen on the scan. Video recording or the use of mobile phones is not permitted. The sonographer will give you a picture to bring home. We appreciate your understanding and cooperation. Please don't be afraid to ask us any questions before or after the ultrasound.
Mothers start to produce colostrum from about 20 weeks pregnancy and for the first few days after birth. Colostrum is known as liquid gold and is the perfect food for your newborn baby. It's easily digested and low volume but high in energy. Being able to express and store your colostrum can be very beneficial. If you and your baby are separated for any reason, or if your baby has difficulty feeding or any health problems, you can use a supply that you have stored. You will also find it easier to express milk for your baby if you've practiced beforehand. It's important to follow the instructions to hand express safely and to stop expressing immediately if you feel painful contractions. Talk to your healthcare provider before you start hand expressing. To watch an instructional video on how to hand express colostrum in pregnancy, go to the whatsupmom.ie website.
Hi, my name is Caroline and I'm a midwife working here at the maternity unit in Mullingar. I'm going to talk to you a little bit about how important it is to stay upright and active throughout your pregnancy and also during your birth. It's really important the whole way through your pregnancy is to stay as active as you can and to try and get out every day, at least once a day, for a good long walk. And the importance is that this encourages baby to come into the birth canal in a good position for birth. So there's many positions that we would talk to you about throughout the antenatal period. And that would include a lot of the steps included in the labour hopscotch tool. So now I'm going to go through some of the equipment that's available to you when you come to us. The birthing ball, it provides a soft surface for women to sit on or to lean against while carrying out simple exercises. A lot of women like to sit on it and rock from side to side. Others prefer to maybe move their hips in a figure-of-8 position. And many women like to use it during contractions with their partner supporting them or using counter pressure at the same time, which can provide a lot of relief during any kind of discomfort that they may be having. We also have the Kaya stool. The Kaya stool offers women the opportunity to kneel on all fours but provides a bit of support whilst adopting an open pelvis position. Whilst using the Kaya stool, women can also sit up onto it. And we just demonstrate that now. And it assists with abducting the pelvis a little bit so that baby can move right down into the birth canal also. Your partner again can become involved. He can sit behind you or they can sit behind you and support you while you're in this position, and you can lean right back on top of them and feel supported throughout your pains. Another additional position with the Kaya stool is, I'll just ask you to stand up for 1 second. You can kneel and you can use it in a rolling position. So if we go down onto our knees, that's it. And you can just lean over it and you can just roll over and back and over and back and over and back. And that can really assist through very painful contractions. You can either continue to roll while you're having the contractions or stop and roll in between. In addition to that, we have the beanbag, and with the beanbag, women can adopt any position they feel comfortable in. You can use it on all fours, you can lie on your side, and whilst in the beanbag, it's also beneficial to use the peanut ball. The peanut ball is also very beneficial to use during birth or active labour. It's shaped like a peanut and it fits nice and snugly between the woman's legs, and it encourages the pelvic outlet to increase so that the labour can progress, and it facilitates the descent of baby's head down into the pelvis. So labour hopscotch is also a tool that we promote for women to assist with remaining upright and mobile throughout their birth. It offers a step-by-step tool that offers different positions that women can adopt to assist them through their labour and through their birth. It's not just limited to these, there's many others to add to the collection, but it's just giving you an example of what you might like to incorporate into your birthing plan.
Hello, welcome to Midwifery Suite. I'm going to talk to you about induction of labour. There are many different reasons why somebody is induced. Usually, if everything is okay, we wait until your 10 days over. If there is a reason why you may need to be induced before that, your obstetrician will talk to you about that there and discuss it with you. I think it's important to remember that induction of labour is not labour. Induction of labour is trying to get you into labour. So usually what happens is you're admitted to one of our wards, to either delivery suite or to antenatal ward, and there you're initially assessed by a midwife to check you and your baby's well-being. And then an obstetrician will see you and examine you and decide on the method of induction of labour. There are a couple of different methods of induction of labour. One is a propess, goes in like a tampon, and that is a form of prostin gel in a concentrated form, or else we give you a prostin gel, or if the neck of the womb has started to open up, we break your waters. We then encourage you then to mobilise, to walk around, to have a normal diet, use the Hopscotch methods to try and help you go into labour. Whenever you go into labour, we bring you to the delivery suite, and then we monitor you and your baby closely. Okay, I just wanted to emphasise that it can take a while to get into labour. It can take a couple of days even. Obviously we hope that you will go into labour that day, as I'm sure you do, but just to be aware that it can take a couple of days to go into labour. And throughout that time you will be monitored closely.
Hello, my name is Trasa. I am one of the labour ward managers, and I'm going to talk to you about pain relief options available to you in labour. We would recommend utilising the natural methods of pain relief, such as the deep breathing techniques, labour hopscotch, TENS machine, utilising your warm packs, and taking a hot bath. All of these methods are very, very useful, and sometimes all women will need in early labour. There are, however, other options available to you also here in the labour ward. Firstly, there's the Entonox, the gas and air, which is inhaled through a mouthpiece. This is very effective at helping you breathe through your contractions. You take the mouthpiece and inhale the gas when the contraction starts. You use your deep breathing techniques. It will help you to cope with your contractions during labour. You can also avail of pethidine injection. This injection is given alongside an antiemetic or anti-sickness injection. It will take the peak of the labour contraction away. You may feel a little drowsy after taking this medication. You would be advised to stay in bed after having this injection. The next option available to you then is the epidural. An epidural is an injection in your back. It is administered by the anaesthetist, who will discuss the options, advantages and disadvantages of an epidural and ask you to sign a consent prior to its administration. It is a very effective method of pain relief in labour. All of these options will be discussed in detail with you and what is best for you at the stage of labour you are at with your midwife, and she will be there to support you with your choices for pain relief in labour.
Congratulations! My name is Evelyn and I'm the manager of the postnatal unit, and I would like to welcome you here after the birth of your baby. We would love for you to use our new Serenity Suite, which was created especially for new mums to relax and have some quiet time with their baby day or night. This suite is named after the Celtic goddess Danu, who is considered the Great Mother of Ireland, representing knowledge, wisdom, nurture and strength. Danu represents how strong you women are and empowers mothers as they embrace on this new journey of motherhood. If during or after your stay you have any questions, we will be delighted to help, so please don't hesitate to contact any member of staff.